Okay, polycystic kidney disease. It is the most common life-threatening genetic disease in the world, affecting 600,000 people in the U.S. and 12.5 million worldwide. There are two forms, hereditary of two forms of hereditary. It's childhood or adult manifestation. In childhood, it is rare, as a rapid progression, and usually it is an autosomal recessive disorder. And the adult onset is an autosomal dominant disorder, and it's latent for many years. So the disease involves both kidneys. The cortex and the medulla are filled with large, thin-walled cysts that are several millimeters to several centimeters in diameter. And sometimes the cysts enlarge and destroy the surrounding tissue by compressing. So symptoms, early on there's no symptoms, and it only appears when the cysts begin to enlarge. First manifestations are often hypertension, hematuria, or a feeling of heaviness in the backside and abdomen. It can be UTI or urinary calculi for the symptom, and the chronic pain is one of the most severe problems the patient has, and the pain is usually constant and severe. Some of the complications of the disease are the chance of losing kidney function to the point of end-stage renal disease. It can also affect liver, heart, blood vessels, and intestines. It can cause cerebral aneurysm, which may cause a rupture. The diagnosis for this disease are based on the clinical manifestations. Since it's genetic, the family history of the patient is good to know. Ultrasound is the best screening measurement. Also, other tests include CT scan and IV. There is no specific treatment for the disease. Major concerns are preventing infections such as UTI and the treatment of those infections, nephrectomy. Also, on the end-stage renal failure, the patient may be in dialysis or can do a kidney transplant. Management of end-stage renal disease include diet, fluid restriction, drug, and education. And in this population, counseling is very important. And for the nurse, it is a good role to assist the patient and the family to deal with the nature of the disease. And also, in couples, it is important to talk about how it's genetically linked and how their children might be prone to getting it. Okay.